This is one of a group of videos on hereditary cancer, which is the reason that some families have an unusually strong pattern of cancer that's passed down through the generations. If you haven't already, I recommend watching the Introduction to Hereditary Cancer because that will explain a lot of the words and ideas that we use in the other videos. In this video, I want to talk about how a genetic counselor can help you understand the different types of genetic test results and combine those with your family history to help you make a plan for cancer monitoring and prevention that's right for you. I want to briefly remind you that most cancers are not inherited. Most cancers are sporadic or isolated cancers that are caused by aging, environment, and lifestyle. Hereditary cancer affects a smaller group of people. In these families, there is a very strong inherited risk factor for cancer, and some of the people in the family will have a higher chance of getting cancer than the average person. It's important to find these families so that we can offer people increased monitoring and prevention to help them stay healthy. We use two main tools to find families with hereditary cancer. One tool is family history, and the other is genetic testing. Genetic testing is done on a blood sample or saliva sample. In the case of hereditary cancer, the test focuses on a group of genes called tumor suppressor genes, which are normally in our body protecting us from getting cancer. And the test will look to see if there are any mutations, meaning any changes in these genes that might stop them from working properly. In the video on hereditary breast and ovarian cancer, I briefly mentioned the different types of test results that are possible, and I want to go into more detail about those in this video. The first type of test result I'll mention is a positive test result. This means that the test found a mutation in one of the tumor suppressor genes, and the person who has this mutation has a higher chance of getting cancer than the average person. When we find this information, of course, it can be hard to hear, but there is a range of monitoring and prevention tools that could be tailored to each person that could help them stay healthy using this information. It's also very important when we find a mutation to offer testing to other people in the family because it's very likely that the relatives of this person, that some of them will have the same mutation, and in fact some of them will not. A negative test result is a very easy type of test result to understand from a technical standpoint because it means that we did not find any mutations in any of the tumor suppressor genes. They all look like they're working properly. Of course, though, this can still be a confusing type of result if someone has a very strong family history, and because it means that we haven't figured out what's causing the cancer in the family. A third type of result that we see is an unclear or inconclusive result, sometimes called a variant of unknown significance. And while that's a big mouthful to say, when you break it down, a variant is a form of the gene, and unknown significance means we don't know if this form of the gene is actually a mutation or if it's normal and working properly. With either a negative or variant test result, we can't use that result to understand someone's risk, and we will use the family history and focus on that to give people some more information. I'm going to go into a little bit more detail about variants of unknown significance because we actually see these types of test results quite often, especially when we do multi-gene panels where we're looking at many genes at the same time. It's quite common to get one or two variants of unknown significance. It's important to note that variants of unknown significance are not the same as having a mutation. Most of these variants of unknown significance are actually normal, but they're something that we don't understand well enough yet, and so we need to wait for science to progress so that we can learn more about what it means. A variant of unknown significance comes up because when the laboratory does the test, they take a person's sample, focus in on the tumor suppressor genes, and then read through the entire genetic code of those genes, which is a long string of thousands of chemical letters in the genetic code, and then compares that genetic code to a database. If it matches up perfectly to the normal forms of the gene in the database, we call that a negative result. If it's clearly different from the normal form or matches up to other mutations we've seen before, we call those mutations. But there are so many differences between human beings that we haven't seen everything. There's no, not all the possibilities have been seen yet, and not all of them are in our database. And so when we see something that hasn't been seen very many times before, the laboratory isn't sure if that's a mutation or if it's normal, and they will be careful and call it a variant of unknown significance. There are many normal forms of all of the genes that we are talking about. So there are many normal forms of BRCA1, BRCA2, and the other tumor suppressor genes. It's a little easier to think about genes that do things that we can see, like the genes that determine how tall we are. We know that we all have genes that determine how tall we are, and some of us have forms of those genes that make us shorter, and some of us have forms of those genes that make us taller, but those can all still be normal. They're just differences that cause the variation between people. And it's the same thing with tumor suppressor genes. We can actually have different forms of these tumor suppressor genes that all work properly. Most variants of unknown significance are small changes in the gene. So if we use an analogy of a car as the tumor suppressor gene that's doing a job in our body, you can make a small change in a lot of parts of this car, like the bumper or a cup holder, and that does not stop the car from working properly. That's still called that would not stop the car from working properly. It would still be considered normal or a negative result if we could understand that more clearly. You could also make a very small change in an important part of the car, like a wheel or the engine, and in those places, making that same small change could actually stop the car from working properly. So if we could understand those types of variants better, we would actually call them mutations or positive test results. While science is getting better every day, we still don't know enough about some of these tumor suppressor genes to be able to tell, what's the bumper or the cup holder and what's the wheel or the engine. So when we see these variants of unknown significance, we can't always tell if that subtle change is harmless because it's in a place where it doesn't matter, or if it's really important and a mutation because it's in a very critical spot. So that's why they're called unknown significance. There's a lot of research going on these, and you may even be able to participate in some of those research studies if you have a variant of unknown significance. So that's a good question to ask your genetic counselor or doctor. So basically, a variant of unknown significance, we have to treat it like a negative test result, meaning we can't use it to understand someone's risk. With those variants, we know that there may be more information coming down the road, but for the moment, we can't use it. So let's go on to talk about what we do when we get negative test results or variant test results, and how we can go back to the family history to try and get more information, since the genetic test didn't tell us very much. So it's important to know that every family is different, of course, and there are so many different possible test results. This video can't possibly be talking about all of those. It's really important, if you have questions about your own history or your own test results, to meet with a genetic counselor or another expert to look at that specifically. But just generally, I think it's important to remember that with hereditary cancer, even the person who has a mutation that's increasing their cancer risk has another copy of that same gene from their other parent that's working fine. So when this person has children, he or she is going to pass on one copy of this tumor suppressor gene because the other copy comes from the other parent. Sometimes this person will pass on the copy with the mutation, and sometimes this person will pass on the copy that does not have the mutation. So even in these families with hereditary cancer, about half of the people have the mutation and about half of the people don't. If we happen to do genetic testing for this person who does not have the mutation in the family, we actually end up missing what's going on in the rest of the family. So there are times where, when someone has a negative or variant test result, a genetic counselor will recommend that someone else in the family get tested because it's possible that we've missed something really important in the family. I have another video that will talk about how we pick the people in the family who are the best to do testing, and we'll go into more detail about that. But just briefly, a lot of times we'll recommend that someone who's had cancer, especially at a young age, might be the best person to do testing because we're most likely to be able to find the mutation in the family and then go to everyone else in the family and say, yes, you have this, or no, you don't. It's great to think about how we could keep progressing in science and learn more about variants, or how we could keep testing other people in the family to get more clarification about test results. But it's also important, if we have a negative or variant test result, to figure out what we should do right now. And so that's where we look at the family history. If someone does not have a very strong family history of cancer and they have a negative or variant test result, then their risk might not actually be that much higher than other people, and we might not recommend a lot of extra monitoring for them. But for people who have a very strong family history of cancer, when we have a negative or variant test result, while we're waiting for science and for other people in the family to test, we want to be really careful, because we have to consider the possibility that we've missed something with this test. Maybe there's another gene that has a mutation in this family, or there are environmental risk factors in this family, or some combination of genes and environment that are still putting people at higher risk. And so in these families with a strong family history, but a negative or variant test result, we're still going to do some extra monitoring for those people. The other thing, of course, that's important to remember is all of this is changing really quickly. So if someone has a negative or variant test result, it can be very worthwhile to go back in the future, in a few years, to see if there are any new tests that might be helpful for the family. So hopefully this video was helpful to you in better understanding what the different types of test results are, especially those variants of unknown significance, which can be very confusing, but should not be treated like mutations until we learn more about them. And also how we can put the test results together with family history to try and get more information for you and your family.